Hi everybody, I'm Tash.
And I'm Damo.
And we're so excited to bring you 2024's first podcast of the Bari Chronicles.
Hi everyone, we're here with Sally and Justine from Nutrition for Weight Loss Surgery.
Thank you so much for joining us again.
Thank you for having us again. We're really excited to be here.
Yes, so this week we are talking multivitamins.
Excellent.
Something that is like the bane of my existence.
Oh, I'm a big girl.
Usually you take yours.
Yes, most of the time.
Yeah.
Yes. I haven't been as good. But it's really important after we have weight loss surgery, isn't it, that we...
It's one of the absolute fundamentals. I look at the vitamin regime that we set up for people as an insurance for their health. So we are really trying to proactively prevent deficiencies, not go the other side and try and treat deficiencies. We want to prevent them happening in the first place.
Yeah.
And it is one of the very well-known side effects of weight loss surgery that you are far more prone to vitamin deficiencies. So it's a combination of, if we really boil it down to the simplicity, we're eating less and we're absorbing more. So it's that dual problem that makes you far more vulnerable to those deficiencies. So whenever I meet somebody for the first time and we're talking before their surgery, I make it really clear that having the surgery is also committing to needing to take vitamins long term.
Yes.
Because I've seen that a lot.
Yeah.
Sorry, go on.
No, I was just going to say, along with that reduced, like Justine said, that we're not eating as much because there's that reduced space for food, so we can't fit the same amount of food in. The absorption has changed, but one of the things people often don't think about is there's less acid being available as well, so less acid being produced in our stomach. And what we're often not aware of is that vitamins are often in a form where they're bound tightly to things. And you need that stomach acid to actually break those vitamins apart to be able to absorb them. So with less stomach acid, we're not breaking them apart and we're not actually able to absorb them as much. And sometimes that's something that isn't recognised as widely, is it, Justine? That we can be putting them in, but we're not actually breaking them apart and being able to get what we need from them. So that's why we need much higher doses of them.
Having that food, like we hear about malabsorption and stuff, but that's really what the malabsorption is with our food intake. That's
one of the factors. In a gastric bypass, we're actually bypassing one of the primary absorption sites of the intestine. So we've got less ability to absorb nutrients once they pass through the stomach into the intestine as well. So there's a multitude of impacts of the weight loss surgery that makes it much harder to meet our vitamin needs. And I think people can have a false sense of security. I'll often be told, look, I'm eating really well. I'm doing absolutely fine. I feel fine. I don't need to take vitamins. And they feel like they're a little bit unnecessary, so they'll drop away. And you do tend to have quite a good storage of vitamins, of some of your vitamins in your body that can last a long time. So again, that first year, if we're having regular blood tests, we perhaps aren't taking our vitamins as well as we should be, but bloods are looking good, we can feel like, well, I don't need them. I'm getting away with not taking them. But it's then beyond that first year, we start to see stores drop. We start to see those deficiencies pop up. So it's just such a easy way to protect yourself from those deficiencies developing, to commit to those multivitamins. Damo, what do you find is your biggest barrier to taking them?
I guess initially I didn't have a good support network in place. And my dietitian at the time, she actually recommended I just go to Woolworths and get those kids chewable gummy lollies. multivitamin, and
Yep.
it just didn't really feel like I was doing any good. And then I suppose I had a blood test about 8 months after, and my GP said, "Oh, all your vitamin levels are great." And he said to me then, he said, "Those gummies that you're taking probably aren't really doing much." So I just put two and two together and went, "Oh, well, I don't need to take vitamins anymore."
Yeah.
So
Yeah. and he was right that those gummies you were taking probably weren't doing much at all. And I think that's one of the things that we do quite often. We have for use with our clients when reviewing blood tests and things, we have this big list of all the nutrients that we need and the recommended dietary intake. So there's studies to guide what they think healthy people need to stay healthy and be healthy, and levels of all the vitamins and minerals. So we have a chart where we have all those recommended nutrients laid out, and we regularly add vitamins as they pop onto the market into our chart and assess how many of those RDIs, recommended dietary intakes, that the vitamins meet. And the gummies meet somewhere between 0, depending on the particular one, 0, maximum 3 of the RDIs out of 23. Some of them meet absolutely none. Some might meet 3. Whereas when we look at those, and we know people get sick of us carrying on about the weight loss surgery specific multis, they meet closer, somewhere in that range, 17, 18 of those 23 nutrients that we need. And some of
when
them
you say the bariatric specific multis, I suppose my initial barrier used to be, well, what makes them any different to what I can buy at Coles for half the price if they're on special?
Yeah.
And that, I really feel that
and it is specifically
I
that
think,
they've got more.
that is a really common question.
They've got
like,
more
it really
in
is.
them.
Are they really different? Are they really different?
Yeah, they are. Yeah, and that's why we and people will say to us, that we know they're a significant expense. They're not as easy to access because they're not at the supermarket and they don't go on special for half price in the Woolies, vitamin aisle, and you can just throw them in your trolley. But they do have the levels of vitamins that we need, more of those levels of vitamins that we need, and specifically the vitamins that we know and minerals that are difficult to absorb after surgery due to those changes that we were mentioning, the reduced absorption sites and those sorts of things. They have high levels of those nutrients in them. And we don't just believe what the companies say. Oh yeah, we meet your needs much better. We actually put them through our chart. We look at them. We look at what's available on the supermarket shelves, and well, they're actually right. What they're telling us is correct, that they are meeting.
So is that actually governed?
Yeah.
So
is that governed, and that these
governed?
companies can't just say, "Oh yeah, I'm meeting it," and just take mine? Is there someone that actually says yes, they are meeting that?
There's a lot of tricky regulations around vitamins, and it's unfortunately some of the rulings are that the vitamin companies can't say that they do specific things, or they fix specific things, or they meet specific needs. But what we do know is, a lot of the studies that tell us what problems people have had occur, what health problems people have had and what deficiencies they've had after weight loss surgery, the companies do tailor what we need to try and help prevent those problems. So, but they can't say, if you take our vitamin after weight loss surgery, you won't get X, Y, or Z.
Yes.
There's a lot of rules around that.
I think that's great.
Do that.
I think it at least we seem to have some standards in place that that they can't just say whatever they want.
Yeah, and I think the companies do their very best to follow the guidelines, to differentiate themselves from the over-the-counter, from the supermarket brands, because that's their job, is to tailor something specific to the weight loss surgery community that doesn't have too much of what you don't need, but has plenty of what you do need. So like they are expensive, but it's an absolute waste to take something that's not meeting your needs that are equally, they're pricey. Any vitamins are quite pricey. And if you're investing, but it's not actually preventing deficiencies for you, it's not meeting your needs, that's problematic. So I think there's that reassurance that it's tailor-made for the weight loss surgery challenges.
Yeah. Well, I know for me, in my first year, I was actually diagnosed with deficiencies at month 7. So I wasn't taking what was recommended to me, and I've been very open on social media about my first 12 months and the challenges that I faced, purely because I think it was really important for me to own the fact that I made some poor choices because I got offended in one of my follow-up appointments. And because I felt that, because I felt hurt and just offended by what had been said to me, I wiped off the thought of taking a bariatric specific multivitamin. And I was diagnosed with deficiencies at month 7.
Wow.
I blew through my stores.
Yeah.
I was all fine at month 6. And then by the end of month 7, I was so sick. And my tests were terrible. They were absolute, because they sent me for more tests then. And from then, I became Little Miss Compliant bariatric specific multivitamin taker, because look, life is expensive, isn't it? Weight loss surgery came at a very significant cost, but also if I don't invest into my health in the long term, then I'm going to have a poor outcome in my health. So it just made sense to me that I need to actually prioritize that.
100%. And I think you said it, Tash, you were feeling so unwell. And I think we underestimate how vitamin deficiencies can affect our physical and mental health. So, they have a really profound effect on how we're feeling. And we underestimate that. It doesn't feel like a big deal. I think before weight loss surgery, and looking just at the general population, unless there's a deficiency, there's not a great need to take preventative vitamins. So we underestimate how important they are for your well-being. And an example is a vitamin B12 deficiency. That can start to manifest as a feeling of depression. So, we can think we've got problems that are just to do with our mental health, but if we actually correct some vitamin deficiencies, it can support that. Now, that's not for everybody, but it's just an example of the reasons we want to stay on top of those vitamin levels.
And sometimes you don't associate those things as being related to vitamins. Like you can be thinking, I'm not feeling good, I'm not feeling well mentally, I'm not feeling positive. Maybe I need to seek, some therapy for my mental health or some antidepressants or something like that. And it's very interesting that sometimes we think, well, because the solution we might feel for that is a medication, that's more important to invest in than the vitamins, whereas the vitamins may actually prevent us feeling that way. So it's such a tricky balance, and that's why we're so open and honest about, we know it's a significant investment, but it's one that people need to be aware of when they go into surgery, or it can be more costly.
It's interesting because I guess depression and feeling low can really be associated with a lot of people after weight loss surgery. And, we wonder why, and I know I did, and, it was about 2 years post-op, and I was just feeling like crap.
Yeah.
And there was a few of my vitamin levels were low, and my GP,
because you weren't taking it.
he said, you need to, he gave me all these different vitamins that I was needing to take. And, but even then I was still sort of sitting there going, why can't I just have an antidepressant to make myself feel better? And I didn't understand that.
Yeah.
I guess to me, I grew up seeing my dad's mum. She had her pantry, and it was full of every vitamin you could imagine, and slippery elm and all this stuff. And so, but grandma was always really sick. So I guess I grew up thinking, it's just a scam.
Yeah.
And so when, and I
Yeah,
guess I had
true.
that preconceived idea that, well, it didn't help my grandmother. So,
Yeah. Is it real? Is it true?
Yeah, is it
Will
actually
it really
gonna help me? Yeah, and I think, when we're looking at mental health, if you are struggling, going to your GP, certainly investigating the cause. Is it a deficiency? Is it not to do with that? But having your bloods checked. And I think it comes down to, as a bariatric patient, we need to really be keeping an eye on what your bloods are doing. So year 1, the recommendation is to have your bloods checked every 3 months. Year 2, every 6 months, and then annually thereafter. Yeah. But if you're not feeling right, if you're starting to feel, physically unwell or not feeling yourself, a bit foggy in the head, it's always best to go and get your bloods checked. Just check that there's nothing going on, because that deficiency, if it lingers for a long time, that's where we can have real problems.
Wow.
So what are the things that we should be looking out for in terms of deficiencies and how it may manifest in our bodies if we haven't been sticking to a vitamin regime?
So it can be everything from top to toe, Tash. So we can have, as I said, lack of concentration. It can be
so many things.
Feeling just really that you're not remembering things so well. It can be a GI effect. So it can have diarrhea, constipation. We can have, gut.
It could be your eyes. It could be something like, for example, that case that we saw, Justine, one of the surgeons we used to work with, he also worked in a public hospital, and he had a patient present to emergency with night blindness, unable to see at night. Now, he actually had previously done bariatric surgery on that patient, and when they presented with night blindness, realised that they hadn't been taking their vitamins. They had a vitamin A deficiency. They couldn't see at night. So there's so many. It's really and it could just be the brittle nails. It could, like Justine said, so many things. It could just be lethargy from an iron deficiency and tiredness, and it's just so wide-ranging. It could be poor wound healing. Like if you get a paper cut, it seems to hang around for 2 weeks. The inability to, like if you're getting a problem with your nerves, the inability to actually grip a pen properly, and you're thinking, well, I'm trying to pick up that pen or pick up a credit card, and you don't have that grip. Wow. That could be potentially a deficiency involving some nerve damage. Wow. There's so many things.
Yeah, so literally top to toe. But if you're not feeling good, best place to always head to is GP. Get checked, get the bloods checked. Is it vitamins? Is it something else? But trying to prevent that by committing to that daily regime.
So are there different steps that we can ask for? Is it just a general thing? Will our GPs know what to test for all the time? Because sometimes I've found that in the past, my current GP is very good, but in the past my GP wasn't testing some things that I was deficient in, because it just required a little bit of a different sort of a test.
Yeah, I don't think all GPs are going to know exactly what to test, which is challenging. It can be, looking for bariatric specific physicians can be useful.
Okay, excellent.
Yeah, but it's.
But even at minimum, with a general GP, if you're sitting there with, I guess, for people listening to this, if they are no longer in touch with their weight loss surgery team, they don't have a bariatric GP, if you're sitting with a GP and a GP says, well, what do you think I should suggest? I know this sounds simplistic, but tell the GP to pop into Google bariatric blood tests long term.
Pop out a
don't you think, Justine? as a
Yep, that's
very
great.
basic, and
That's great
it'll pop
advice.
out a list
Thank
from
you.
the ASMBS. Yeah, because it's just something that anyone can do. But if you put bariatric specific blood tests and long term, they should be able to. It'll pull up a list and give you that basic screen, and that's even useful for a GP to then know that for the next person who comes in. Because if it's not someone they see routinely, and they might only see someone every few months, even every once a year, it's just useful. They'll think, oh, that's right, there was a list. I can get that.
I guess
and order it
we sort of expect GPs to know everything.
Yeah.
And I think
that can be so many things that they have to
no one
know.
can.
It can be so unfair to,
That's right.
to expect that. So I think it's good if we can sort of
Advocate
do that
for ourselves.
advocation for ourselves and say, no, I need you to check this, so that we know that we're being
thorough with our own health as well.
100%.
And no one can know everything, and we're certainly not trying to sound
not at all
negative about GPs who don't know, because it's a classic example. We know this area quite well, but if I have if I'm picking up the children from school and a mum says to me, oh, you're a dietitian, aren't you? My child won't do X, Y, and Z. I say, oh, no, unless I'm only a weight loss surgery dietitian. I can't deal with children. So we all have our things that we can deal with quite well. So, and unless you see people with a certain requirement, then
that's exactly right. That's why I think that was really great advice, and it's good for us as bariatric people and the people that are listening to be aware that it's important for us to advocate for ourselves when we go to the wonderful professionals that that we're seeking support from, and just have a basic understanding of the things that we need.
Yeah.
Because nobody is going, I mean, of course, professionals care about us, but nobody has to live our lives for us except us.
Yeah.
And we need to take some level of responsibility as well, I think, anyway. That's definitely what I had to do. I had to stand up and go, okay, well, I did this to me. I went against advice, and now I need to take advice and walk out the journey of going from deficient in all the things to not being deficient.
Yeah. So just talking blood tests, just a tip for your listeners. Before you have your blood test, hold your vitamins for 48 hours. It gives more accurate results. And a lot of people don't know that.
Yes. I didn't know that. I didn't know that, and I spent a couple of years still having my vitamins because I don't want to not take them. Otherwise bad things might happen. But it was only very recently that somebody informed me that no, you should not take them.
Yeah, just for 48 hours, and it only affects some of the levels, but it's best just to hold them and you get the clearest picture of what your bloods are doing.
Okay. Yep, that's great.
Now okay, so another topic that comes up a fair bit is B6.
Sure.
We've seen it on the ABC. We've seen different current affair things. So can you run us through the B6 subject?
Certainly. So B6 we always thought of as a water-soluble vitamin that would just excrete from the body if we had too much of it. But a few years back, when we were testing B6 more and more, we were seeing these very high levels in people. And for a start, we assumed maybe they're just not holding their vitamins before their blood test, but it was getting worse and worse. And what happens with B6, it actually accumulates in the body, and we can have what's called hypervitaminosis, or toxic levels of B6 build up in our systems. And the problem with B6, it is so prevalent, and we're allowed to put quite a lot in our vitamins here in Australia. Last time I checked, it was 50 milligrams was allowable per supplement. I'm pretty sure it's still there, but I'd have to double check. And even some of our weight loss, pardon?
Yeah, no,
it is.
Wow. Yeah, well, it's, I think the change, I think now you can actually have up to 100 milligrams, but you need to have a warning, I believe.
Yeah, I think that's what I read on the TBA.
But
can double check.
even our weight loss surgery specific
Yeah.
multivitamins,
Yep.
some of them did used to have nearly 10 milligrams. Now that has been adjusted in response to this toxicity. So the weight loss surgery specific multivitamins have a really lovely low B6 level that's not, accumulating like it was previously.
Mm-hmm.
However, what lots of people will do is add different vitamins to their regime. So they might be taking a weight loss surgery specific one, but adding something else in on top unknowingly. An example that I saw with one of my clients, she hadn't told me she was taking some magnesium for her fibromyalgia, and her symptoms were getting worse and worse. So she was adding more magnesium in, again, not in discussion with me. Now, when we checked her B6 levels, I had never seen any as high. They were just through the roof. I immediately called her, said, look, we need to run through what you're taking. She assured me she was taking absolutely no B6. I said, no, get all your vitamins out and let's run through them. The magnesium she was taking had 50 milligrams of B6 in it, and she was taking 3 a day and had been for a really long time. Now, the problem here was one of the symptoms of high levels of vitamin B6 is numb or tingly hands and feet. She put this down to her fibromyalgia getting worse. So the treatment she was using was actually the cause of the problem for her.
Oh, the poor thing.
I know.
And is that reversible?
Yeah, look, the level comes down. I believe that most of the tingling neuropathy improves. There can be a little bit of carryover depending how long that toxicity's existed. Sally, is that your understanding too?
That's my understanding, yeah. It's so hard to know, like in cases like this where someone does actually have that underlying condition where some of those symptoms are present as it is, in that particular case, it's really hard to know.
That's right.
To, I guess, differentiate between what's making isn't it? So it makes it so tricky. But I think that the challenge is what we're seeing as well when people are looking for their vitamins. Sometimes they're driven to places like I heard because you can get different things that you can't get in the shops delivered to your door, and you can find things that don't fit under those regulations we have in Australia. So now that the TGA know that this is a problem in Australia, if they have over a certain amount of B6 in there, there needs to be a warning to say that. Now, I believe if you've got over 10 milligrams of B6 in a supplement, it needs to have a warning that too much of it can cause that numbness and tingling, the peripheral neuropathy. I just popped B6 into iHerb a few moments ago, and up popped something with 250 milligrams of B6. Now, that shouldn't actually be accessible in Australia, but we can just get it delivered on iHerb. And we know that those doses over time are really going to cause people to have significant symptoms.
That's so
really,
scary.
really high levels.
Yeah, it is.
Yeah. It is, isn't it? It is.
Amazing.
It is. And it's appearing in so many places. It can accumulate the amount that you're taking on a daily basis. Another one we see commonly, the hair, skin and nails problems, Justine. And all sorts of supplements, or where people are adding in extra supplements and it's throwing out the balance of what you need and causing other problems. That's another thing that we see quite commonly. They try and stop everything and just take the ones, the bariatric specific ones, and any you're prescribed to treat a deficiency, of course, rather than trying to mix and match different things.
Yeah, one I see is
because we have a lot of people that will take stuff because they're scared of losing their hair, and, which I totally understand that, but it could actually be doing us a bit of damage by doing that.
Yeah, look, really ironically, a lot of hair, skin and nail supplements have quite a bit of selenium in them. Now, when you add that selenium on top of the selenium that is in a multivitamin, so a bariatric specific multivitamin, we can have above our upper limit. And the irony of that is excess selenium causes hair loss. So the treatment, again, is making the situation worse. So hair, skin and
It's
nails.
worse than the cure.
Yeah, so I always, my advice if somebody says, Justine, I'm so worried about my hair, like, should I add a hair, skin and nail supplement? I say, back away. Take your multivitamin, take the extras that your dietitian or team have prescribed for you, but don't add something extra in without checking, because that accumulation, that doubling up, we can exceed upper limits, and that can make things worse. So the hair loss after weight loss surgery, I mean, the body's gone through surgery. That can cause hair loss.
Yeah.
Rapid weight loss can cause hair loss. Stress can cause hair loss. So we have, again, a cascade of different things that happen with weight loss surgery that can make us vulnerable to some excess hair loss in the first 6 to 12 months. So we tend to see it happening between 3 and 6 months that shedding starts. If we focus on getting our protein right, so meeting our protein needs, making sure we're taking our correct vitamin regime, having regular blood tests, by 12 months, that really should have resolved, and we should be seeing that hair start to thicken back up. But it's, we can say that we know it's really triggering and frightening for people. Our hair's, a huge part of our identity and self-esteem. So we can see the temptation to jump into wanting to buy those really beautifully marketed hair, skin and nail supplements. But I really discourage people to do that.
It'd be like if my beard started falling out. I'd be
You'd be devastated.
Well, I mean, how do I hide my sagging neck if I don't
Damo?
have a beard?
with
Oh,
my
dear.
bulldog clip.
No, but it is important
that's
just
right.
to not
With my
mix and
range of
match.
neck bulldog clips that I'm going to be bringing out now. I actually did lose half of my hair.
Wow.
But again, I was not being compliant.
Which half?
I had so I went bald back to about here.
Wow.
And I had big patches right through my head. It was very, very, it was very triggering. It was very scary.
Yeah.
And unfortunately, just for me, it just seems to be a thing. So with all of my plastic surgeries as well, I've also had not as bad, but I've also lost a little bit of hair each time. And it is, for me, it's a surgery thing.
Yeah.
How long do you think it takes for your body to find its balance again and that hair starts regrowing? Because often that's a concern for people too. When will it actually come back? And
For
what does that
me,
look like
it's
for
at
you?
6 months.
Mm-hmm.
It starts at 3 months post-op, always. And for me, it's by 6 months. I look like a little porcupine. I have little baby hairs everywhere. But I'm always very happy to see that now, because I realize, it means my hair's coming back.
Yeah.
But it is a challenge. It definitely is. But as you said, the protein and the vitamins, it does come back. It just takes time.
Yeah. If it's happening
Well,
beyond
another
12 months, that's when you really need your bloods checked. If it's progressing beyond 12 months, we're thinking, right, this could be nutrition related, not just the rapid weight loss, not just the surgery now. So then I'd really encourage people to get full set of bloods and check what's going on.
Yeah.
Another question.
Yeah. One thing to keep in mind with
No, you go.
Sorry. Oh, I was just going to say the other thing to keep in mind with blood testing is even when we are doing the right thing and trying to get those weight loss surgery multis in, sometimes even when you're doing the best that you can and taking what you should be taking, you may still get a deficiency. And I think that I was thinking about it then, Damo, when you mentioned about feeling like you had the relative who took all the vitamins and they were always sick and you thought it was all fake. And I think there's some really good stats. There's a researcher in the Netherlands and who has produced some wonderful stats on vitamins. And his research that he's been involved in, he's found that if you've got a sleeve, if you're just taking an over-the-counter vitamin, likely that 75% of people with a sleeve taking an over-the-counter multi will get a deficiency. And if people with a bypass are taking an over-the-counter multi, 83% are likely to get a deficiency. So they're pretty high stats, 75% with a sleeve, 83% with a bypass. But even those who are taking weight loss surgery specific multis with a bypass, 22% of those people are still likely to get some sort of deficiency. So that's where that feeling of, oh, well, it's not working anyway comes in. But your risk of getting those deficiencies is much lower if you're actually taking them. So I feel like we can sell that, oh, take your multis, you'll be fine. But it doesn't always pan out like that, but you're likely to still be better off.
If you are in that category, in that 22%, what do you do then?
I guess when you have the blood test, it should indicate what deficiencies you have, and then we give additional ones to top up. But we need to select those carefully to target what is low. So, for example, not just taking another multi and then potentially throwing the balance out of other things. It's treating those specific deficiencies. So it's not a generalizable thing. It needs to be tailored
all sorts of different deficiencies. You know, I might be treating a vitamin C deficiency, not in somebody taking their bariatrics that covers their vitamin C, but that's usually in somebody not taking anything. So I might treat a vitamin C deficiency, a vitamin A deficiency. We've had zinc deficiencies, and we actually isolate those nutrients, give the correct dose to bring that level up, recheck, and make sure we've restored that level. So it's just, again, it comes back to, even if you are 100% compliant, you still need those bloods just to check what's happening in your body. And many people need a few additional vitamins in their baseline regime. So we usually give some calcium and vitamin D. For menstruating females, we'll usually give additional iron on top of that contained in the multivitamin. So it's not just a one-stop shop. So it is getting the right regime set up for you.
Yeah, that's excellent advice. It really is. Yeah.
Something that I did struggle with when I actually did start doing multivitamins was when I read on it that I was supposed to take 2 a day at different times. And honestly, I just took two in the morning because it's like, you know, that was just me. But I was taking 20 tablets a day at that time, and, you know, but how important is it, or is it important that we, you know, do if it says 2 a day, do we do it 1 in the morning, 1 at night, or how do we break it all up?
Your body can only absorb so much of anything at one time. So dividing that dose, having it at separate times of the day, is going to enhance the absorption of what you're getting from those vitamins. And saying that, if I have a client...
Can I just give I've got a comment, Justine, that something just popped into my head of how to visualize that. If you've got, say you're on a golf course, and if you had, let's say there were 5 holes for the golf ball, and you slowly roll 5 balls out, then there's a chance that they'll go in those holes. If you get a bucket of 40 and you tip over the top, you can't absorb all 40. There's still only 5 holes. So that's why we say if you spread it out over the day, you're more likely to land in those holes. Whereas if it's all dumped there at once,
you're just going to waste it.
Does that make sense a little bit?
But in saying that, Damo, if I had a client say to me, Justine, I am forgetting the second dose all the time, I would say to them, you're better to take 2 at once than only 1 a day if it's a 2 a day dose. So, you know, best case scenario, we have that divided dose, 1 start of the day, 1 end of the day. Can't do that, not managing that for any reason, we're going to have 2 together rather than forgetting 1 each day.
Yeah. Okay. And for those of us that take calcium, I take calcium and vitamin D as well. And I also take reflux medication. So that's a very, very common 3 things that a lot of weight loss surgery people are having. And I understand that it's definitely, like these are probably quite individualized questions that I'm asking. But is it important to make sure that we're separating those things?
Yeah.
To enhance the absorption?
Yeah. It absolutely is. It absolutely is. Yep. And particularly with calcium, we know that the absorption of that can be inhibited. So iron and calcium are not always good to be taking together, and the reflux medication, and it is a balancing act. And I would say to anyone who's prescribed those things, talk to the person who's prescribing those for you, and work out how you can fit them in across your day, because it is important to be separating out different nutrients at different times. Calcium, just while we're on that, is a tricky one, because it's another nutrient that people say, oh, my calcium in my blood test is fine, I don't need calcium. But the problem with calcium is your bones are very, very good at maintaining your blood stores. So you can have a blood test and it looks like your calcium levels are fine for years. And then you break a hip and you find that your bones have been leaching calcium for years to keep your blood stores stable. So blood calcium levels are not a good test to show that our calcium stores are actually okay. It's much more effective to have bone mineral density testing, because we don't actually know what's happening in your bones by a blood test, because your bones will just keep sending calcium out into the bloodstream and it'll look
excellent.
fine.
That's very, very, very helpful to know that.
So I need to stop with the just taking 10 tablets in the mouth at once. And
yes, you need to stop
if
that.
you can, Damo, absolutely.
If you can.
I often, with dividing doses, I think about layering up a habit. So if we look at dividing the multivitamin, it might be that you do that at the same time as teeth brushing. So something else you're doing twice a day to trigger that.
I have to brush my teeth as well.
You do. You've got to do that as well. You'll be fine.
Yeah. But just something to trigger that, it's my vitamin time, because that can be, and have a little backup supply. I tell people, have a little supply at work or in your handbag. So if you leave and think, oh, man, I didn't take that, you've got them available. Using a little dosette can be really useful to remind you.
That's a good tip, actually. I think probably having them in the car or something.
Yeah, because then if it comes to mind and you think,
I'm good.
Yeah.
Well, you're just perfect.
No, I'm not. But I do take my vitamins.
Bit of sibling rivalry here, guys. Oh, gee. I think a spare pack in the door of your car, so that when you go to hop in and it rattles as you shut the door, that's also a handy spot.
A very good reminder.
Rattling around.
Yeah.
And then you offer people a lolly and laugh when they chew on it.
No. You terrible man.
So there's
oh dear.
One of the themes, I guess, that we're seeing is that prevention is definitely better than cure. And there's a lot of these things that I've seen around where you can have someone come and hook up a bag of vitamins to you and do an infusion, and
we're actually seeing a lot more of that on in our support group. People are asking about that, or they've done that or whatever. What's your take on that one?
Look, it depends on obviously what is in that solution. And if we think about the nature of some vitamins, they don't last in our system very long. So they're water soluble. So we're going to need more of that daily dose. It's not something I have looked into the evidence for. And as dietitians, we're very bound by working to the evidence. So I don't want to comment too much on that. But my initial thought is many vitamins need to be provided regularly. So I'm not sure the longevity of how helpful that would be. And is that solution tailored for the needs of a bariatric patient would be the next question I'd want to be asking. So a few questions I would have that I would want to look into with that. But certainly if it's something that's been asked more and more, it's something that as dietitians we need to be over and understanding. So I will put it on my list of to-dos to really look into that.
Awesome.
Yeah, that'd be great, because we are seeing that
we are.
come up as well as the patches and the ones where you can order vitamins to
tailor-made vitamins as well. All these things pop up in our in the support group, in chats. We get messages, and we just thought, well, we will ask the people that know.
It sounds like Sally and I have some homework to do in that space. But, I mean, we use infusion.
Yeah. And I think what we do know is there's not evidence yet for those things coming out in the bariatric space. Like, we can hunt generally, but I think there's been nothing.
So really it's better off sticking to what we know works.
It's very important then, isn't it? That
That's
we
right.
stick to those things that we know are going to work.
Yeah, because I mean it could be very dangerous if we don't, and we think we're doing the right thing, and 6 months later we find out no, we haven't, and suddenly we've got to play catch up too.
Yeah.
I mean, obviously, I would say that, obviously, like for iron infusions and things, well, that's different. I mean, I had to have quite a few of those over the years, because they've been around forever.
Yeah, and that's targeted. It's done under the advice of a medical team, and is treating that deficiency. So
excellent.
Yeah.
And I think trying to do that, when you said about you can order the tailor-made vitamins, I think it's probably very tricky to get that balance right if you're not up with the body of evidence as well. So if someone says, I think I'm feeling a bit this way, maybe I add a little bit extra of that, that's where things can get a little bit dangerous too. So I think it's best to go with what we know is safe and what we know is tailored as best it can be for the general weight loss surgery patient, and then backing up with the individual
We have
testing.
people that ask quite often if they should start their bariatric multivitamins before they have surgery. What do you guys think about that?
So we screen all our clients or patients' nutritional levels before their surgery. I don't get any of my patients to start their multis prior, but I will treat deficiencies prior. So often we're treating low levels of iron, vitamin D, B12. We like those levels to run a little higher than the general population, particularly leading into surgery, just to give you a nice boost to go in. But I don't typically start the multi prior, but I do like my clients to start it as soon after their surgery as possible. It's really, really important in those early post-op periods that we are taking a multivitamin, and I'll often see people drop away with it because, particularly if they're not feeling well, if they're a little bit nauseated, if they're sick, they might feel really reluctant to take their multi. They might think it's making it feel worse. It is absolutely critical to have it at that time, because there's, for example, B1, so thiamine is an essential nutrient to have. We're very vulnerable to that level dropping quite quickly after weight loss surgery, particularly if we're unwell. So it is crucial that we take that multivitamin, even if we're feeling not so good.
Wow. So what do we do if we are feeling sick every time? I take my multi and now I feel sick.
So try taking it with food. So trying to take it with food can be helpful. Some of my clients will take it just before bed, so they're not sitting with that nausea through the day. If they can go to sleep before that kicks in, that can help them. It's trying it at different times of the day, seeing if there's a time it sits better for you. Changing brands sometimes can help. Different people respond better to different brands. If you're really struggling, talk to your team. There might be, options or different things we can try for short periods of time that cover the absolute essentials that we need to get in if we can't do the multi, if we've got a period of not feeling so well.
Yeah,
Yeah,
excellent.
that's great.
Don't just stop. Do not just go cold turkey, I can't take it. Really liaise with your team if you're struggling in those early days.
Yeah. And as dietitians, you would rather hear from your patients, wouldn't you? If they are struggling like that.
100%. We don't just want to see our patients when things are going well. And I think there's a real temptation for people to cancel their appointments or not be in touch with us if they feel like they're not doing a good job, or how can I tell the dietitian I can't take that multivitamin because I don't like the taste of it? They're just going to get cross at me. We're solution focused. We're here to work with you and come up with strategies to make things as easy for you as possible. So tell us if you're struggling. That's my biggest piece of advice. We can't help if we don't know, and we're never here to judge. We're just here to support and keep you as healthy and well as possible.
Yep.
I love that, because I think for most of us, it's we don't want to disappoint our dietitian. We don't want to disappoint our surgeon. Even I noticed on the cruise that we did with BSA members, there was a lot of apologies going to the wait staff because we weren't eating all the food. And we're so used to, I guess, being a disappointment,
or feeling like
we're a disappointment, that we can get scared to ring up and say, hey, I'm failing, and we feel like we're failing again.
But
it's not about failure, it's about empowering people.
Seeking support when you need support. And I think it comes back to, if that phone call or that reaching out afterwards you don't feel better and more supported, it's probably looking for a different provider, somebody else to walk alongside with you, because you should always leave your consultation or phone call feeling better, have more knowledge, feel more supported than when you reached out. So that's our job, Damo. That's what, we're here to make journeys as positive as possible for people. So you're not feeling like a disappointment, because that's never how we would perceive things.
That's great.
Yeah.
There was one other question I want to, just as a follow-up to what we were talking about. If I was going to have surgery, how long before would you guys sort of want to have a blood test done on a patient to check if there are any deficiencies leading up to the surgery?
Well, it really depends on your clinic. There's not a set time, but we need time to correct deficiencies. But say somebody doesn't have a long lead time and they come and see us and they've got very low iron stores, we can do an infusion and get that up really quickly. Or if they've got low B12, we can do an injection of B12 and get that level up quickly. We can do high dose vitamin D, so we can move quickly if we need to correct things. But if there was a deficiency that we weren't able to correct quickly, we would likely delay that surgery until we've got that person at a really good nutritional position to head into that surgery.
Yeah,
that's so important.
Fantastic.
It really is. I know for me, even with my plastic surgery, my first one, I went into it with levels that were okay for a normal person. They were the low end though, and I had a very, very significant bleed during that surgery, and it took me months and months to recover. So when even after our weight loss surgery, when we're considering other surgeries, it is very important, isn't it, that we have our bloods checked and be sure that we are well in ourselves to go forward with those sorts of things.
I would always recommend that, and not just the bloods, get the protein right too heading into surgery. Really make sure you're meeting your protein needs. So nutritionally.
We often talk about protein. Yeah, we often talk about protein being involved in that repair of the body after any surgery. But the thing to remember is that lot of those vitamins and minerals are actually part of the chemical reactions that help the healing as well. So yes, we do need the protein there, but there's all these little chemical reactions, and that's what those vitamins and minerals are feeding. So if they're not there and the right chemical reactions aren't occurring in the body, the healing doesn't occur either. So that's another thing that's often forgotten a little bit, that you can't recover if you haven't got the right levels of nutrients to be firing on all cylinders, I guess you could say.
100%. And that is what happened to me with my very first round of plastics. And it was months. I felt like rubbish.
Yeah.
So now if I have any type of surgery, I'm always off, make sure that all my blood tests are good, and I'm also always prioritizing the protein in the lead up, because otherwise it is not nice.
Yeah.
Awesome.
Yeah.
Thank you so much for joining us today.
We really appreciate it.
It's been amazing.
Yeah, thank you
for having us.
Yeah, we're really looking forward to it.
Tash, could you perhaps, when you're getting your vitamins this afternoon or this evening, I believe Damo may not be taking them, so would you just like to shoot one his way?
I will. I will nag him, and
I don't like this call anymore.
You're getting picked on, Damo.
I've had enough of you too, he says.
I'm the one that his wife calls in when she needs help to get him to do the things that he needs to do for himself. So now I will start with my very persuasive persuasions.
Thank you so much.
We'll leave you with that, Damo.
You're most welcome.
Thank you.